Number 3, diabetes on the chair. Continue metformin. Don't touch insulin ever. I don't care how confident you feel. The moment you adjust the patient's insulin dose, you have left dentistry and blended into someone else's job description. Number 4, patient goes down in the chair. Is it a faint or is it anaphylaxis? One clue decides its heart rate. Slow means faint, fast means adrenaline. Now, into the thigh, intramuscular, and if your hand reaches for the IV line, that's a mistake advanced practitioners make in resuscitation base, not one dental graduates make in clinic. Number 5, numb lip after extraction that won't go away. The examiners are not testing whether you panic. They are testing whether you know exactly when to stop watching and start referring. Number 6, warfarin patient needs an extraction. The nervous student stops the blood thinner to be safe. The correct student keeps it running and controls the bleeding locally, because a bleeding socket is annoying but a stroke is not. Number 7, something has gone wrong and now you have to tell the patient 4 words carry half the marks here. Acknowledge, apologize, explain, document. Skip one and no amount of correct clinical management saves you. Here is the thing nobody tells you. Every one of these 7 steps has already appeared in some form in a past ADC sitting. They are not hypothetical. They are recycled.